This is a Medical Minute brought to you by the physicians at Waterbury Hospital.
The issue with exposure to the sun during the summer is related to multiple risk factors. One is the length of time they're out and the intensity of the sun. So for people who are light-skinned or who are prone to it, it's not a good idea to be out in the sun for any reason. The skin cancer doesn't usually develop, just in the summertime, but it's in a combined exposure over time. So anybody who ends up with lesions on their skin, though, that are growing or irregular, that they're at risk. But the exposure to the sun is really what causes them. So it's kind of cumulative over a long time period. So people tend to like to be outside during the summer, which puts them at higher risk because of the exposure. Nobody knows for sure why any cancer develops, but presumably that the people who are at risk for that, who have a genetic predisposition, the exposure to the ultraviolet light does cause mutations in the cells and can cause skin cancers to grow. The best protection is not to go out at all or to wear clothing, but short of that, there are skin blocks, sunblocks. But none of them work 100%. So if your skin is exposed to the sun, even with sunblock on, you're still absorbing some of the UV radiation. So the best way to do it, not to go outside. The second best way, to be covered up completely.